Hey guys, this is Mr. Bullshit, your teacher for today, from the Bullshit Academy.
Have you ever had that aching, pulling, itching feeling in your legs? If you have never had those feelings, you are in luck, because these feelings are unbearable. It is ineffable to say how much I want to rip my leg or hand off when these feelings arise. If you are curious enough, stay till the end of the video to learn all about the medical explanation behind. The video will be split into many parts: definition, signs and symptoms, epidemiology, risk factors, causes, consequences, management and treatments and complications and prognosis. But before that, don't forget to subscribe to my channel. I really want to get to 1K subscribers before September this year. This condition is called the restless leg syndrome. It is also known as Willis-Ekbom disease, primary RLS and idiopathic RLS. It is a neurological disorder, sleeping disorder, and a moving disorder that causes unpleasant or uncomfortable sensations in your legs and an irresistible urge to move. It often occurs in the late afternoon or evening hours, and often most intense at night when you are resting or after an extended period of rest. RLS symptoms typically affect both sides of the body at the same time, though it is possible that it only affects one limb. In order to determine the severity of the condition, moderate level is defined by the symptoms occurring once or twice a week, but often result in significant delay of sleep onset, with some disruption of daytime function. For severe cases, the symptoms occur more than twice a week. This condition can begin at any age and can occur in both males and females, yet females are more prone to develop it. Other risk factors include age, individuals living with the movement disorder Parkinson's disease, end-stage renal disease and hemodialysis, neuropathy, sleep deprivation and other sleep conditions such as sleep apnea, pregnancy or hormonal changes, and use of alcohol, nicotine, and caffeine. Most causes of RLS are unknown. It is suspected to run in families. Low levels of iron in the brain, dysfunction in part of the brain that controls movement, and the disruption of dopamine levels may also lead to this condition. Various types of drugs, including anti-nausea drugs, antipsychotic drugs, antidepressants that increase serotonin, cold and allergy medications that contain older antihistamines, can also aggravate RLS symptoms. RLS not only makes it extremely hard to fall asleep or return to sleep after waking up, but also creates numerous problems. For instance, changes in mood, exhaustion and daytime sleepiness, problems in concentration, impaired memory, decreased productivity, depression, and anxiety. The temporary treatment might be to simply move your legs or walk. For mild to moderate RLS, small changes in lifestyle might be useful. For instance, one should avoid or decrease the use of alcohol, nicotine and caffeine, change or maintain a regular sleep pattern. Try moderate, regular exercise, massage the legs or take a warm bath, use foot wraps or vibration pads, do aerobic and leg stretching exercises of moderate intensity. As for a more severe form of RLS, medications might be more useful. In the beginning, iron supplements, anti-seizure drugs such as pregabalin, benzodiazepines such as clonazepam and lorazepam, dopaminergic agents such as ropinirole, pramipexole, and rotigotine. Yet it is important to note that dopaminergic agents can only be used for a short period of time. If the aforementioned medications are not useful in relieving the symptoms, opioids such as methadone, codeine, hydrocodone, oxycodone can be used. Moving on to complications and prognosis. More than 80% of people with RLS also experience periodic limb movement of sleep, which is the twitching or jerking movements during sleep that typically occur every 15 to 40 seconds, sometimes throughout the night. Yet it is unlikely that people with PLMs will develop RLS.